all to today's session. Myself Rajita, and here in today's session we are going to discuss again regarding the management of fluid electrolyte imbalance. So I guess in the previous sessions or in the previous few sessions we have read regarding the different electrolyte imbalance that can commonly occur in patient. Even we have seen the fluid imbalance if it is occurring for an individual, what can be the basic causes of it, what can be the clinical manifestations, as well as we have seen the management or the basic principle and basic treatment modalities for every imbalance of electrolytes and fluids. Now, you need to understand the concept that we are going to learn here regarding the management in an overall way. So, whenever a patient will be present with certain fluid and electrolyte imbalance, often we are going to see more than one type electrolyte imbalance will be present for a particular individual in a combination. That is the reason we will be always following a basic method of assessment and management to prevent the progression of electrolyte imbalance and to prevent the complication development associated with fluid and electrolyte imbalance. So let's get started with the topic of the overall management of a client with fluid and electrolyte imbalance here. So first, definitely whenever a patient is present in a clinical setup with the sign and symptoms, the basic and the first thing as a medical professional we need to perform is a thorough assessment through which we are going to basically find out the sign and symptoms which may be indicating that the person is developed with a certain type of electrolyte or fluid imbalance, and we may identify the type of it, as well as we can send the particular patient for further investigations procedure or laboratory studies to find out the exact causes and exact fluid electrolyte imbalance that is present to initiate the treatment for the client. So here we are first going to discuss regarding the assessment. So as I have mentioned, assessment of the client with fluid and electrolyte imbalance definitely will be focusing on the clinical manifestations that is present for the client. So when we have read about each and every fluid and electrolyte imbalance, whether it is a hypercalcemia, a hypermagnesemia, or a hypocalcemia or magnesemia, or any other electrolyte conditions, we have seen each and every fluid and electrolyte imbalance will be showing different features. Understanding the concept of clinical manifestations often will be helping our medical professionals to identify at a very early age that what is the person is suffering from. Now, once we are noting down all the clinical manifestations, sign and symptoms for the client, next, obtaining a subjective and objective data from the client with suspected fluid electrolyte balance would be done in a clinical setting. Now, obtaining subjective and objective data often will be including all the detailed history of the particular individual. Now, this history definitely would be helping a medical professional to identify the probable causative factor that is lying behind the development of fluid electrolyte balance. So let us study here what are the components of the data collection here in the patient with fluid and electrolyte imbalance. So important health information should be collected here. So present and past medical history. A detail of it should be collected from the patient or from the caregiver. This also helps a nurse or a medical professional to understand whether the person is suffering from any disease that is increasing the chances of the development of fluid electrolyte imbalance for a person. Next, also, we are going to collect the data regarding the present and past surgical history. Now, basically, we will be focusing whether the person has undergone any surgical treatment related to renal or bowel system, whether there is any external collecting device is placed for a client. For example, like any usage of colostomy or any presence of colostomy, whether it is there or not, we should assess. Now, external devices, if it is present or if a person has undergone a renal or a bowel surgery, often we are going to see those persons will be having more likely to develop with fluid electrolyte imbalance. That is the reason a detailed surgical history, a past and present surgical history should be done here. Next, we are going to see the lifestyle of the client. So, for sure, here we are going to collect the history of the patient related to their lifestyle and their habits. We are going to ask client regarding their dietary pattern or dietary intake, their exercise level and their exercise tolerance, their daily lifestyle, their professions, as well as we are going to also collect the data related to their habits, like whether a person is having any previous habits of alcohol consumption or whether the person is having any habit of smoking. So this data of lifestyle definitely would be helping a medical professional to understand. Now suppose we are collected the data where a patient is saying that her or his dietary intake is very rich in calcium. So as the sign also is indicating, definitely we can conclude that a person is may likely to suffer from hypercalcemia. So that is how the data which will be collected by history collection will be often supporting the sign and symptoms, which will be ultimately helping us to conclude the diagnosis. Also, collection of the data should be done about the family history. So majority of the client may have an underlying disease process development, and family history would be showing that the chances of the development of particular disease is more for the particular client. So family history also sometimes helps us to identify the underlying disease progression, and we can actually initiate our treatment at earliest, which will be ultimately helping the client to prevent with any complication development. So as we are finishing with the collection of health history, next we will be definitely going for physical examination. Here, physical examination plays a very, very important role, because in physical examination, we are gonna identify all the sign and symptoms that are plays a supporting role with the sign and symptoms that is present for the client to conclude the diagnosis of fluid electrolyte imbalance. So on physical examination, we will be focusing on the examination of the skin of the patient initially. So often, in case of a person who is having fluid volume deficit, we will be noting it down there, skin turgor will be reduced. Often the person can present with cold and clammy skin. So these are the indication that the person is suffering from a fluid volume deficit. Now, if you are doing a physical examination for a client who are present with fluid volume excess, we are going to note that often the client will be present with edema over the extremities. So it is indicative that the person is suffering from fluid volume excess. So now the necessary management would be initiated at earliest to manage the client. So the next we will be focusing on the vital signs of the client, because you need to understand often we're going to see the client vital signs will be disturbed due to fluid and electrolyte imbalance. So first we're going to assess the pulse of the particular individual who are having sign and symptoms indicating fluid electrolyte imbalance. So first we're going to assess if the person is present with bounding pulse. It is basically suggests that the person is having fluid excess. In case of rapid, weak, and threatened pulse, definitely we can identify that there is fluid volume deficit is present for the client. So that is how, by understanding which type of changes is present in the pulse reading, we can conclude whether a person is having a fluid volume excess or a deficit. Next, we are going to assess the blood pressure of the client. Often, a client with fluid volume excess will be present with hypertension. And in case of fluid volume deficit, we're going to see the client can present with hypotension. So that is how we are going to assess the blood pressure and can make ourselves understood that what kind of fluid imbalance the person may have. Now, also, we are going to assess the respiration and respiratory rate and rhythm in the client. Often, with fluid volume excess, we are going to auscultate that the client will be present with moist crackles over respiration. Even sometimes the person can present with deep, rapid breathing if there is presence of metabolic acidosis. So that is how we are going to conclude what type of fluid imbalance the client will be having. Now we will be also measuring or examining the muscle strength of the client, often with the presence of signs and symptoms indicating fluid electrolyte imbalance. So cramping, carpal spasm, or some signs which is indicating the client is present with tetany or some other abnormal muscular contraction and spasm will be often indicating certain type of electrolyte imbalance. Even we are going to assess the behavioral and mental state of the client as well. Restlessness, confusion, altered level of consciousness in different changes in the mental status are very common associated with electrolyte imbalance. So that is the reason we are going to assess what type of changes a person is having. Now, once we are performing the physical examination, it may be suggesting whether the client is suffering from a particular fluid imbalance or electrolyte imbalance or not. Now, to identify the electrolyte imbalance, that what exact the electrolyte is changed into the person's body, we need to go or we need to send the patient for further investigation method. Basically, we will be performing certain laboratory studies to find out the exact changes into the electrolyte level in the body. So initially, we will be doing a serum electrolyte studies. This is a profile where we are going to get all the information related to the presence of electrolyte level in the body, which will be indicating whether the person is suffering from excess or deficit into the electrolytes. Next, in addition to our electrolyte profile, we are going to also include the measurement of arterial and venous blood pressure. Now, this will be a very good indicator to identify whether a person is having any complication related to the cardiovascular system and whether there is any chances of the altered perfusion related to the fluid and electrolyte imbalance. Serum urine osmolarity or serum and urine osmolarity often will be done for the client, which will be indicating the presence of hyper or hypoelectrolemia. Next, we're going to also deal or also will be doing the studies for serum glucose level, which will be often indicating the client and the related electrolyte imbalance for them. Blood urea nitrogen studies will be done to identify the functional ability of the kidney. Even serum creatinine level will be often measured here in this case of the client present with the signs and symptoms indicating fluid electrolyte imbalance. Venous blood gas sampling often would be done. Even arterial blood gas sampling can be done to find out acid-base imbalance associated with electrolyte and fluid changes for a particular individual. Urinary specific gravity should be always measured for the client with the signs and symptoms of fluid electrolyte imbalance. Even urine electrolytes studies will be done to identify the presence or the abnormality that is present associated with fluid and electrolyte balance in the body. Now, once we are completing the laboratory diagnosis or studies, definitely it will be showing the exact presence of the electrolyte, which is showing whether it is like present in a less amount or more amount, right? So depending on that, we will be concluding whether the person is suffering from any imbalance or not. Once we are making the conclusion of the diagnosis, next definitely comes in the treatment. So we are going to manage the treatment with fluid electrolyte imbalance in a very prompt and initial stage to prevent the development of complication. Now, if the condition is treated at earliest or treated initially, the person shows a very great recovery associated with this condition. So, treating the underlying disease plays here a very vital and important role. So, basically, the fluid electrolyte imbalance often will be associated with some systemic disease. So, treating that particular disease here plays a very important role. The next management or part of management includes the oral fluid and electrolyte replacement. Here, generally the cold drinks are avoided. In that place, we will be able to provide them oral rehydration solution if the client is able to tolerate oral fluid. We will be often providing a solution which will be having content of water, potassium, sodium, glucose would be administered depending on which type of fluid electrolyte balance the person is having. The next management or the basic concept of management lie in the intravenous administration of fluid and electrolyte or intravenous replacement of fluid and electrolyte. Often a client who are having intolerance towards the oral intake of fluid and electrolyte, they will be going for intravenous. Most of the client with severe diarrhea, vomiting, or poor absorption of the certain electrolytes from the gastrointestinal tract, chronic kidney disease, or certain factors which are impairing the electrolyte regulations in the body will need a intravenous administration or replacement of fluid and electrolyte balance. Here I'm going to read now what are the most common type of solution that would be generally used for the intravenous replacement of the fluid and electrolyte. Now we are going to read here regarding the commonly used crystalloid solution in case of fluid electrolyte replacement. So the first type of crystalloid solution includes the dextrose solution or dextrose mixture in water. Basically, we are going to find here two type of solution that includes a isotonic solution of dextrose and a hypertonic solution of dextrose. Isotonic solution, basically, which is also known as physiologically hypotonic solution. It is basically 5% of dextrose solution in water. Whereas we are going to see the hypertonic solution will be containing 10% of dextrose in water. So that is how the isotonic and the hypertonic solution will be used for the client in different scenario. It will be provided only, or it will be providing only free water without any electrolyte. So in case of fluid deficit, we will be often seeing the dextrose solution will be used to provide adequate amount of fluid replacement for the client. Provide thus, as we have studied, that it will be providing the free water which will be always necessary to increase the renal excretion of the solution or of the solutes. So we are going to see if a client is having excessive amount of electrolyte present in their body, we will be often seeing the usage of dextrose water or dextrose solution to promote the urinary excretion, to excrete the excess solutes from the body. That is how the dextrose solution is very commonly used crystalloid solution to promote the fluid replacement as well as to increase the urinary excretion of solutes from the body. Next type of solutions which are very commonly used solution is saline. Now we are going to see three type of saline can be present. It can be hypotonic, isotonic and hypertonic. Hypotonic solutions will be containing 0.45% sodium chloride in it, whereas isotonic solution or isotonic saline solution will be containing 0.9% of sodium chloride, and hypertonic solution will be containing 3% of sodium chloride. Now, depending on the patient need and condition or fluid and electrolyte imbalance, we are going to administer the hypotonic, isotonic, and hypertonic saline solution through intravenous line. Now, this saline solution often will be providing free water in addition to sodium and chloride. It also provides no calories. So it is completely having no calorie. Next, often we are going to see this saline will be used to expand the intravascular volume. Even it will be replacing the extracellular fluid losses. So if a client is having fluid deficit, we will be often seeing the saline will be used in our intravenous fluid replacement. It will be also used to treat symptomatic hyponatremia, because you need to understand the saline will be providing the sodium associated with the free water. There is a reason even in case of hyponatremia, we're going to use the solution or saline solution. Next, or the third type of solution we are going to see is dextrose in saline. So it also have three basic type: isotonic, hypertonic and hypotonic. So in isotonic, we are going to see there will be 5% of dextrose in 0.225% of saline. In the next, where we are going to see the hypotonic, here we are going to basically see that there will be presence of 5% of dextrose in 0.45% of normal saline. In the hypertonic solution, we are going to see there will be 5% of dextrose in 0.9% of saline. So it is a mixture of dextrose solution and the normal saline. So basically, this particular type of saline or solution will be providing sodium, chloride, even the free water. This basically will be using to replace the hypotonic losses. Even it will be using to treat the hypernatremia. So as we have studied this three type, next we are going to read about multiple electrolyte solution. The majorly used multiple electrolyte solution is Ringer's solution. So it is basically an isotonic solution, similar in composition to plasma, except that it has excess chloride, magnesium in it, but there is no absolute bicarbonate is present. So it does not provide free water or calories. So where we are just want to supplement the electrolytes, not water, we are going to use the Ringer's solution. This basically will be used to expand the intravascular volume. Even it will be helping to replace the extracellular fluid losses even. So this Ringer solution will be often and commonly used in clinical setup to provide adequate amount of electrolyte to the client if they're having any imbalance. Also, there is Ringer lactate solution, which is also isotonic solution. We're going to see it will be having a similar composition of plasma, that it does not contain magnesium, but that is the only difference. So we are going to see it will be used to treat losses from the burns injury, even if there is any injury to the lower gastrointestinal tract. Now, this will be used to treat mild metabolic acidosis even, but should not be used to treat lactic acidosis. So lactate drinker solutions, note it down, will not be used to manage of lactic acidosis. It does not provide free water and calories. So this particular lactate drinker solution only will be providing certain amount of electrolyte to the patient's body. Now, as we have learned regarding the basic treatment or management of the fluid electrolyte balance, definitely the treatment also will be varying from person to person depending on their underlying disease condition. Now, that disease condition can be managed with various medical therapies as well as surgical therapies. But this is the basic management for directly controlling the fluid electrolyte imbalance. Next, there is one more technique which will be often used basically to monitor the client associated with fluid electrolyte imbalance is the central venous access devices placement. Now, central venous access devices will be placed to monitor the hemodynamic stability as well as to administer various medications and to have a easy access to the central line to manage the client with fluid electrolyte imbalance. Now, using this central venous assisting device is very common in management of fluid and electrolyte balance. We are going to see there will be usage of centrally inserted catheter, peripherally inserted catheters, as well as implanted port will be often used. So this obviously helps to identify or monitor the hemodynamic stability, as I mentioned, often will be helping to collect the sample from central vein as well as to administer medications. It is very helpful. So these are the basic management which will be often done initially to manage a client with fluid electrolyte balance to prevent the further progression and complication development associated with it. Now, there are certain other management which would be often provided to the client that includes definitely it will be starts with the treating the underlying disease condition, as I have mentioned. The various medical agents can be used or can be prescribed to treat the underlying disease depending on the patient condition. Next, we are going to see definitely a correction of the fluid electrolyte will be done in the body by administering intravenous fluid and electrolyte or else oral fluid electrolyte. So this is the second step where we have already discussed that directly we will be managing the client with intravenous or oral administration. Next target is to correct the acid-base balance. So we are going to see in next session what do you mean by acid-base imbalance. So you need to make it clear here that the fluid electrolyte imbalance can ultimately cause the development of acid-base balance in the body. So that is the reason the acid-base balance also should be maintained here while managing a client with fluid electrolyte imbalance. Continuous monitoring of vital signs and hemodynamic status plays here a very vital role to identify any alteration which will be indicating that a person may go for a progression of the disease or development of complication. Monitoring continuously helps a medical professional to identify any alteration at earliest and initiate the probable and exact management to treat the patient. Next is the, as I have mentioned, the hemodynamic state monitoring. Associated with that, the level of consciousness also should be monitored for the client, as it will be almost always will be indicating altered level of electrolyte in the body. Intake output chart or maintenance of it here plays a very important role in the management of a client with fluid volume deficit or increase, even the electrolyte imbalance. Nutritional support should be provided basically by a nurse to manage the patient fluid electrolyte balance in the body. Also within the hospital setup, proper or adequate rest and sleep would be ensured by the medical professionals. A proper pace of the activity and rests should be done by the medical professionals. Care of the central venous or central arterial devices should be done even if there is placement of any. So, assessment of the devices, dressing changes into the locations, cleaning those areas, injection cap changes, as well as maintenance of the catheter patencies is the major role for a medical professional. Reducing the chances of infection with the client who are present with fluid electrolyte imbalance plays a very important role to reduce the excess increase in the metabolic demand by the body. By providing some hygienic practice and maintenance of personal and environmental hygiene, a medical professional can improve the quality of life of the client here, even the recovery rate. Often, a medical professional, basically a nurse, would be continuing or continuously monitoring the client in a clinical setup, as well as adherence to the treatment regimen would be ensured by them. So these are the initial step of the management, which will be often followed for the patient who are suffering from fluid electrolyte imbalance. Now, remember, it is very important to note underlying disease condition treatment and prevention of the disease progression and the complication development here is the main goal of the all over management. So I hope in this session you are completely understood the concept of the management, what would be done for different fluid and electrolyte imbalance depending on the patient condition. So I hope you enjoyed the whole session where we have discussed in detail regarding each and every type of fluid electrolyte imbalance and their management. So thank you so much for attending the session. We'll meet you guys in the next session.